Joe Restuccia is my co-chair. And this meeting is being recorded and is currently live streaming on YouTube and is accessible after. The agenda and the materials for tonight's meeting are public and can be viewed on the website. If you don't receive the e-blast, I encourage you to do that and sign up on the website. If this is your first time attending a meeting, the main three things I like to say are: after each presentation, first the committee will ask questions or make comments, then the public or the attendees get the opportunity to speak. Number two, in order to speak, you have to press the raised hand button on your screen. If you're calling in, and I saw one caller today, you have to press *9 to raise your hand. Again, press *9 to raise your hand and *6 to unmute. *9 to raise your hand, *6 to unmute. After the attendees, the discussion goes back to the committee for the business section, and sometimes there's action items. Committee members vote to write a resolution, and that goes before the next full board meeting for a vote. And we can do the self-introductions really quick. Leslie, starting with you. Oh, no, I'm sorry, Joe, with Joe Restuccia. Sorry.
I'm Joe Restuccia, co-chair of the Housing and Human Services Committee, passing it to Leslie. And everyone, please pass it to somebody else next so you can move it along.
Leslie Williams, member of the committee, passing it to Betty.
Hi, Betty McIntosh, member of the committee.
Passing it to?
Oh, I'm passing it to Jessica.
Hi, good evening. Jessica Chait, a member of the committee. I'll pass it to Aurora.
Hi, Aurora Cruz, I'm a member of the committee. I'm passing it to Yadira.
Hey everyone, Yadira Jimenez, member of the committee. I am passing it to Paul.
Hi, Paul Ames, public member of this fine committee, and I'm passing it to JD.
Good evening, Jean Danielle, member of the committee. I'm passing it to Dolores.
Dolores Rubin, member of the committee. I'm passing it to Roberta.
Passing it to Roberta, sorry.
Sorry, on a train. Hi, Roberta, member of the committee. I am passing it to Katie.
Hey everyone, I'm Katie Stokes, member of the committee, and I am passing it to Hector.
Hi, I'm Hector Vasquez, member of the committee, and I'm not sure if I'm passing it on to Samantha.
You're passing it to Pete.
To Pete, there you go, Pete.
And Pete is frozen. So we're going to come back to Pete, and we're going to just talk about the agenda first for tonight. So first, we will have a presentation by the Health Equity and Access to Care Project. Then there is a specific action we have to take regarding a correction to the affordable housing plan that was put in the Dropbox. So there'll be questions, but it's not that complicated. We made a mistake and we're fixing it. The committee update on the temporary shelters is also very brief because DHS is not coming tonight. And then we will do a short report on the NYCHA development, but we're not going to be discussing it tonight. We're just going to report out what has been reported, and that's it. And lastly, we're going to spend a piece of our time talking about the process we went through in our last meeting, specifically to get through the letters and how we managed it. And I want to hear people how they felt about it. Hector.
Yeah, I'm sorry. I do have a question about the update.
Yes.
Since a lot of the plans have not been made public or no decision has been made yet, I'm curious to understand why it's even on the agenda at this point.
It's been reported in Politico as to a prospective plan. We're not going to discuss it in detail at all because we don't have any full plans, but we need to report it out publicly, which has already been put into, into publications. So, but again, I just want to know for the committee members, we're not going to have any sort of in-depth. We're not going to have a discussion. We're not going to go back and forth. Yes, no, maybe. Just going to report. Here's what we learned. That's it. Okay.
But I'm just wondering, why is it? I mean, we're going by a press release and Politico. I mean, it's not like.
No, we're going by report. We're going by reporting in a public, in a publication. Right.
So you're going to regurgitate what's been announced on an article on the website?
No, what I'm going to do is report a meeting that was attended by the community board with the proposed developer, NYCHA, and the Tenants Association, and I'm not going to say anything in terms of yay or nay about it. I'm going to report what happened at that meeting.
Right. But we can't divulge any specifics on it either, because basically no decision has been made or made public either.
Hector, before I even started, I will say, no decision has been made. Okay, so.
So let's get to that
Okay.
item.
I just wanted to make it clear.
Yeah.
Yeah, I just want us to proceed very cautiously. on
Thank
this, that's
you,
all.
Hector.
Thank you.
Turning over to
So,
Maria for the first presentation.
so Samantha.
Hi.
Samantha, yes, I'm having a little trouble with your last name, Weckesser.
You got it.
Oh, I did? Excellent.
On the first shot. Yeah.
Excellent. All right, Samantha. So can you introduce yourself and your presentation? Oh, are you going to be, who's going to be doing, are you doing,
Do it.
you know what I mean? The PowerPoint.
Share my screen. Yeah. Hi,
Nellie,
everyone.
is she sharing her screen or you're doing it?
She has access to share the screen, or I can do it, whatever is easier.
I got it. It's probably easier for me if I do it.
Okay, great. Thank you,
Fine,
Samantha.
do it.
Okay. Let me just pull this up. Oh, can you see it?
Yes.
Perfect. Hi, everyone. My name is Samantha Weckesser. Thank you for the introduction. I'm a doctoral student and also the project coordinator for the Health Equity and Access to Care project, which we call HEAC at the CUNY School of Public Health. And today I just wanted to briefly share so that we can spread the word about the project and get some feedback from you all about maybe things that we should be doing differently and different outlets that are within your community that perhaps we haven't reached out to that maybe we should be reaching out to. So for some background, last year, the Department of Health conducted an analysis looking specifically at Sparks data, which is data that's collected from the hospital system and fed through the Department of Health to look at what differences exist or don't exist between different types of New Yorkers' use of hospital services. Now, this isn't just, going inpatient or for surgery, but includes everything from going in for lab testing to, primary care at a satellite site, all of that. When they looked at the data from both public and private and safety net hospitals, so this includes health and hospitals as well, they noticed two things that they wanted to explore further. The first is that people of color and folks who have either no or public health insurance were more likely to use public or safety net hospitals, and folks who identified as white and or those who had private health insurance were more likely to be using the private hospitals throughout the 5 boroughs. And so those are the key differences that they noticed, and they wanted to dig in more to see kind of what was going on, because all they had was this administrative data, like I said, from the Spark study. So they didn't really have, information about why people are making these choices. And so I kind of alluded to this, but the Sparks data are very limited in what they can give us, right? And they're quantitative. And so they give us things like why somebody went into the hospital, what their insurance was, what the charges were, and some information about the person themselves. So they can tell us like what's going on, but they can't always explain why. So what we are looking at, what the Department of Health specifically is interested in, is exploring qualitatively through focus groups, why it is that people are making these decisions or are not making these decisions. And so they partnered with us at CUNY to try and figure that out and answer that question. And so that's where the HEAC project comes into play. And so, like I said, this is a focus group project that exists to better understand why healthcare is segregated in New York City. And this is all 5 boroughs. And so we're currently hosting focus groups, both virtually, and we're moving to an in-person. The Department of Health has given us the okay to start hosting in-person focus groups as well, to explore why people are choosing or not choosing or being forced or, led or swayed either way, the hospitals that they're choosing to receive care from. And what their experience is accessing care in one or more of those settings has looked like. And so we're looking specifically at factors that are related to race and ethnicity, person's health insurance status, their citizenship, and then select vulnerable groups. And these are 4 different phases of the project. Currently, we're really interested in the Department of Health specifically. It's very interested in looking at the differences between Black and African American folks and white folks, and then again between public insured folks and privately insured folks. And so in order to do this, we are coming to people like you at the community boards and other community-based organizations and, on the ground activities to try and do some outreach and see if we can recruit more folks into the focus group study. And so just briefly, these are all of the partners. So it's really us, the Borough of Equitable Health Systems at the New York City Department of Health, and we are partnering with a variety of CBOs, community-based partners, again, throughout all 5 boroughs. And I just wanted to, so we've presented at, I want to say, about 20 community boards so far to try and recruit for this project and spread the word. And one question a lot of folks have is, what are you asking people? So what are you asking our constituents? Which is an entirely fair question. And so we put these slides together just so that you can get an idea. And I will also share these. I can send them to you all so that you can look at them more closely. But these are the main categories and some of the key questions we're asking. I will say these are not word for word the questions we're asking. And there are more questions than this in the focus group, but we just wanted folks to get a general idea about what we are looking at and what questions we're kind of asking to get at the meat of what the issue might be. And so like those specific categories are, why are you choosing to go somewhere? How do you find care when you need it? What are the factors that are influencing your choices? So do you feel like there are certain hospitals that you can't go to for some reason? Is it that your family has historically gone to a specific hospital and you feel safe and you trust the physicians and the nurses there? So what exactly is it that's impacting your choice? We want to hear specifically about what people's experiences have been. So we want to hear people's stories. The Department of Health is very, very interested in first-person accounts of what people's experiences have been. And then, of course, we want to know what people in New York think can be done or what the Department of Health might be able to do to improve access to care. We also have a number of specific scenarios that we run through that the Department of Health has flagged as things that they've heard through the grapevine or that have been published in media outlets. I see a hand up.
We'll take questions at the end. Just keep on presenting, right?
And so in terms of outreach and recruitment, this is a list, and it's not all inclusive of different entities that we've been reaching out to. Like I said, we've done these presentations at about 20 community boards so far throughout the 5 boroughs. We've had quite a bit of success recruiting folks through the Department of Education parent coordinators who've been very happy to share this information with their school communities, which we're very grateful for. And then we've gone to some in-person events as well. And, we are always looking for suggestions. The more people we have who are interested and want to participate in this study, the better. And so we're taking, any and all suggestions for other places that we should be reaching out to, or anything that you think should be on this list but isn't. And I'm going to share our flyer really quickly after this presentation, but like I said, really looking for feedback. We all want this to be a collaborative process. We really want the community's input on where we need to be doing recruitment outreach and what your thoughts are about things like the questions we're asking, how we're going about these things, etc. And so I'm going to share the flyer really quick with you so that you can see kind of what it is that we are using. And I'll also put this in the chat and send it afterwards. But so this is our flyer. So the study is open to anyone who lives in New York City, who has access or tried to access some sort of healthcare in the last 12 months at a New York City hospital, either for themselves or for someone else. So you can be a caregiver or a parent, a guardian of somebody who you've helped navigate the healthcare system. We're looking in this phase specifically to recruit people who have private insurance or Medicaid, who are adults and who can speak English. We will be opening this up to non-English speakers in the next study phase. And in order to enroll in this study, you can follow this link or scan the QR code to take our screener survey. Once somebody screens in, I get their contact information and I reach out to schedule a 2-hour They're usually less than 2 hours, but we block off 2 hours just to be on the safe side. Focus group, virtually, we are moving, like I said before, to in person to be more accessible for folks. And they're held, in the morning, in the afternoon, the evening. We do have them running during people's lunch hours, during the weekend, and we are very flexible with the times and dates that we are holding these. Folks who participate receive $50 in cash for participating. So we pay folks directly through Cash Apps. In-person focus groups, people would be given the option between just, getting a $50 bill or getting paid through the Cash App.
So Samantha, our chat is disabled for our public meetings. You should send this flyer to Nellie and she'll put it out to our listserv for the community board so it can go out. Let's start with Aurora.
Thank you so much for your presentation. It sounds like you guys are doing great work. But you answered one of my questions, which was what's your incentive for people to do it? Because you're asking them for something and they're gonna want something in return. And so you did say, and I want to make sure that I was clear about this, the English speaking only at this time, and then you'll have, is it just Spanish or any language specifically?
We're going to have more than just Spanish. We will definitely have Spanish. I think what will happen is, and this will also be dependent on kind of resources that the Department of Health is able to provide, as well as the different organizations we're partnering with. Dependent on the borough, I believe we would probably go based off of the most popularly spoken languages, and have co-facilitators or facilitators speaking that language and then translating the focus group transcripts back into English for us to do our analysis.
And then just one last question. How are you protecting identities?
That's a good question. So for focus groups, what we do, so the screener, obviously you're giving me, the ability to reach out to you. So I have your name, Cash App, I have your name as well. All of that information is securely stored on the school public health servers. It doesn't move out of those servers. The only person or people rather who have access to that particular information are me and the admin team on the project, which includes the project lead, Dr. Diana Romero, and our other project coordinator, Elizabeth Figueroa. So it's just 3 people who have access to it, all securely stored. And then in the focus group itself, we have people sign an informed consent form, the Zoom chats, and when they're in person, it won't be video recorded, it will be an audio recording. But on Zoom, we understand that there are significantly more ways that somebody could potentially steal somebody's information. And so there is an explicit expectation that the participants in the focus group not share the information outside of the focus group. Everybody is asked to use a pseudonym. So nobody's using their actual name. The facilitators are not using people's actual names, whatever fake name they come up with. And that is how the data is transcribed and stored as well. So the focus group data itself is actually never linked to a specific person. All that information is kept on our server separate.
Thank you. Leslie, followed by Betty.
Samantha, thank you for your presentation. As a former CUNY employee, I thank you as well. My question is, you talked about an assumption, and maybe it's an assumption that this is being made here, is that the person has a choice as to what institution they go to. Because often I've been told that if somebody gets ill and they go to a particular institution that doesn't want them, they're bussed back to another institution and put at their doorstep. That's one. And number 2, often people who you're talking about here live in neighborhoods that don't have these private hospitals. So they have no access. And so there's no way that they can possibly get to. It's the kind of way the city has been divided up so that the poor is in one area, they have nots, don't have access. So I just throw that out.
No, yeah, and I think that's a really valid point, and it's the reason that we're holding these focus groups. I know sometimes we'll give these presentations and somebody will come back with, well, we already know the answer to this. Yeah, but it's you can't do anything at the city level without city data, right? And so that's why we're collecting the data. I will say, I don't want it to seem like we're making that assumption, because we are aware that even when you go, like if somebody called an ambulance, right, and you get into that ambulance, oftentimes like a person will look, the EMS person will look at you, look at your insurance, and that's how they determine what hospital you'll go to. And we've heard stories like that. The Department of Health has heard stories like that about, you know, somebody's personal decision being overridden by a paramedic, right? And so we really need to collect those stories to make a powerful argument to the city Department of Health so that they can then take it up to the state level and advocate for actual policy change, which is why this is so important. But thank you so much for raising that, because that is a really valid point. And it's something a lot of people don't realize.
Thank you.
Betty?
I thank you for the great presentation. I bet that asylum seekers would love to get the $40 that you're offering if they had 2 hours to give. I was wondering though, are they disqualified if they have no insurance?
So no, they're not disqualified. It's just that during this particular phase, we aren't actively recruiting asylum seekers or new immigrants. That will be done in our next phase, which we're hoping to start this summer or early next fall. So those people will be outreach to, we're hoping to get to them through the CBOs. We do understand that there are additional precautions that need to be taken with that group to protect, you know, both their mental health and their privacy. And so that's kind of why they're in a later phase. Right now, we're mostly focusing on English-speaking American citizens.
Katie?
Thanks. Thanks for your presentation. I was wondering, I guess 2 questions that are related. One, like how much outreach have you been doing, and like what sort of, like, are you finding it successful, or are you getting a lot of people responding? Because I guess my impression from seeing the list of who you're reaching out to is like, I guess I'm wondering, is there any chance that you'll have, or that you can have a partnership with hospitals, or, you know, so you could be handing out pieces of paper or something, or advertising in the hospital so people are actually getting, you know, hospital service now in whatever hospital they see it, you know, and that seems like that would be a good group of people to be reaching out to. So those are my questions.
Sure. Yeah, no, those are great questions. So to start off with, so the project lead, the PI, Dr. Diana Romero, previously worked on a study looking at NYC options, which was the precursor to New York City Cares, and also worked on a lot of health and hospitals qualitative research when they were closing St. Vincent's Hospital and things like that, connecting focus groups. And so she does have relationships with a number of hospitals, as does the Department of Health, obviously, throughout the 5 boroughs. However, there is a little bit of a conflict with going directly to the hospitals, because we're asking people to talk about their experiences with discrimination. And so partnering necessarily with the place that hurt them may not be super fruitful. I will say that's not something that we've taken completely off the table at this point. It may come into play down the line, because I hear what you're saying, right? It makes sense to grab people right after they received whatever treatment they're going into the hospital for. It makes complete sense. But I think that if it comes into play, it will come into play down the line. And to answer your other question, it's been a little slow. I mean, so we have done outreach to about, like I said, 20 community boards. We're in the process of doing outreach to a number of CBOs throughout the city. We have some targets in each of the boroughs, and we're hoping to recruit more people that way. We do know, like, people work, people have kids and busy lives, and right now is a very stressful time for New Yorkers, as have been the last 3 years. So we are very cognizant of that. So I would say it hasn't been at the point where, like, we can't accommodate people, if that answers your question, but we are getting, you know, steady folks. That is to say, there's always room for more.
Right.
Okay. Yeah, I guess I had been concerned that maybe you weren't going to get enough. So, yeah,
Also,
no, more the merrier.
Also, probably you don't want to do a customer survey as you're leaving the hospital from whatever you had to deal with in the hospital at that point in time. I think it might be a little bit of difficulty. Let's go to Jessica.
Yeah, sorry, it's actually, and apologies if you mentioned this, but it's a follow-on. What is the number of people you are looking, like what's your enrollment number?
So I think we're hoping for 200 to 250 participants for phase one. We're hoping to hold 46 focus groups total. So right now we've held, I believe, 15 focus groups since we launched in the fall.
I'm sorry, how many did you say? I just missed that number, sorry.
15.
No, right before that when
Oh,
Jessica
46.
asked.
So 46 focus groups with about 250 participants.
Thank you, 250 participants.
Mhm.
Okay.
And so just to help Samantha, do we have any place that we want to refer her to for this, to be able to recruit people for this? Around the room, anybody raise your hand? Obviously, I'm going to bring up the Ryan Center, right, as a location where people have used the hospital system, obviously. Any place else specifically? Betty?
I recommend churches that have food pantries and that sort of thing, particularly the Church of the Holy Apostles that's in Chelsea.
Great.
Yeah,
Pete?
they have lines and lines of people.
Pete?
Encore, 49th Street.
Encore Senior Services, 239 West 49th. Hector?
Yeah, the community centers for Fulton and Elliott houses, I think it'd be a good idea to try to get some information out to them.
So Fulton Community Center, 119 9th Avenue, and Hudson Gill Community Center at 441 West 26th Street.
And Joe, Fountain House has a lot of members.
Fountain House, 425 West 47th Street.
And Hartley House.
And well, yeah, Hartley's not open all the time now, so I wouldn't send there. Samantha, have we at least? I will again recommend you get the flyer to Nellie, so she'll put it in our newsletter that goes out. And anything else we can help you with or for referral sources?
No, I don't think so. If you guys don't mind, if you have a newsletter or a webpage, just posting or sending out the flyer to listserv, we would really appreciate it. I'll send it. I'll connect with Nellie and send again after we get off today, and I'll follow up with her. And then, if anyone has any questions, I'll put my email in the chat. You can feel free to.
The chat is disabled.
Oh, right. Sorry, you said that.
Yes.
But you can say your email address really quick one more time.
Yes. So it's my first name dot my last name at sph.cuny.edu.
And I have so many questions for you. I will email you.
Please do.
I don't want to keep us here longer.
Yeah, and we will definitely put that in our Dropbox too.
Great. Thank you guys. Have a good
night. Thank you very much.
You.
Our next item is a complicated thing, but simple at the end of the day. So everyone's familiar with our affordable housing plan. And I'm going to share the screen. And what we are dealing with here is a mistake that was made. So here you have on the affordable housing plan, the image. Is this large enough or should I make it larger? People see it?
Larger.
Larger. Okay. Give me a moment, Betty. I have to stop the share and make it larger. Okay, there we go. Now, better? Everybody better? Better? Give me a head shake.
Yes.
Okay, good. So this concerns the area for West Clinton between 11th and 12th Avenues that we propose for rezoning. What you're looking at is a graphic of the plan from 2019, and where you see the West Clinton area goes up here to West 55th Streets. And we proposed doing a rezoning to allow residential use in the area that is currently reserved for manufacturing use. And that would create a certain number of apartments. However, one second. When we reissued the plan last year, there was a mistake in the graphics, and we dragged this line down from 55th to 54th Streets. We also deliberately eliminated the Intrepid parking lot on 12th Avenue because we put that in the Empire State Development portion. And we said we would have 897 units. So that mistake number one was the boundary was wrong. Mistake number two is the change in the methodology was not captured. So the units went down. Now we're here today to fix this amendment. We fixed the boundary, but we also fixed the error in the methodology, which brings the number of possible units up from 897 to 1,673. So this was really a major calculation error and a minor boundary error. The reason this has come up at all is because the board had a briefing from a developer about a prospective development site between 54th and 55th Streets on 12th Avenue to propose a rezoning for a 40-story building. And as we looked at this more carefully, we realized, in fact, this was in the West Clinton area. The FAR is currently 5. We're talking about bringing it from 5 to 7.2. And this would be entirely out of character. So therefore, we went through the whole process, looked at how we got here. And the proposal tonight is to create a minor amendment for the district, for the affordable housing plan, sorry. So I want to go around the room with this and just get people's questions or thoughts about it, starting with Betty. You're on mute.
I think you need to do the corrections and maybe have a little addendum somewhere that there were corrections. And does that put the whammy on the developer?
No, we actually in the briefing, the board members who were there made it clear that we would never approve a 40-story building in an area that currently has a 13-story height limit.
Okay. Okay.
Leslie?
I agree the change should be made. There's no other impact on any other project, right?
No, none at all.
Yeah, I think it should be made.
I mean, I thought, considering all the work we've done to make an error like this on 156 pages was not that bad, you know.
Mm-hmm.
Jessica?
Yeah, I don't think this is really a question.
Okay, Pete?
I don't have any questions regarding the changes, but I think the changes should be made and highlighted.
Right, Hector?
No, I think it's pretty self-explanatory. I'm just curious as to why in front of the, is that because of the parking lot in front of the Intrepid Museum?
Yeah, we moved the Intrepid parking lot to the other section with DSD, right.
Gotcha. Okay, thanks.
Paul?
Yeah, my only question was, I'm sorry, I missed if you said it. What exactly was the reason for the big jump up between 897 and 1673?
We use the all the current housing plan has the current methodology HPD uses. Yeah. This particular section, we didn't change the methodology to the current methodology, kept the old one.
Okay, thank you.
Aurora?
I agree with everybody. I think you're right, Joe. Like, that's pretty good for 156 pages, right?
Thank you. Katie?
Thanks. Yeah, it sounds good. Can you just verify? So you're saying that the methodology isn't changing with this text or with this amendment. It's just we're just correcting a bad calculation. Is that
right?
Correct?
In other words, we moved to a new methodology, a current methodology, and this particular section didn't get that new methodology as the rest of the plan. It makes everything consistent throughout.
So now by putting in the correct number, we're not with this amendment, we're not changing anything else. We're just saying, oops, sorry, our bad. And here's the correct number.
Yes, but we are increasing the number of units because the old methodology yielded 897, and we're almost doubling that, which is good, not bad. Obviously.
Right.
Yeah.
Okay, but marvelous. All right.
Okay. JD and Dolores?
So moved. No, I believe the building on 54th, 55th was 60 stories. My recollection.
Actually, you are right, JD. I'm sorry. Yes, 60 story. It was quite a remarkable thing. Dolores?
Yep, so moved.
Next up is Yadira.
I'm okay with this. Who am I to argue with the professionals?
Oh, please, please. You are a member of the committee and you can argue as much as you'd like.
No, I am okay with this.
And I think our final person is Roberta. Can you speak,
Actually,
Roberta?
it would be me being the final.
I'm sorry.
person.
I'm sorry.
Roberta can go first.
I think she might be still in transit. Roberta, if you can hear us, we'll come back to you. Maria.
Yes, to what everyone said. I was going to ask a lot of questions, but I finally processed it and I get it now.
Yeah, it is a little bit complicated to put together.
Yeah, I get it. I get it.
So
yes, it sounds good.
JD made a motion. Can we just have a formal vote by hands of all those in favor of making this correction amendment? Okay.
Can you see everyone, Joe?
Yes, I see most of them. I think I'm looking at everyone except for Roberta saying yes, but we'll come back and she can always speak when she gets to a place she can be seen.
Okay.
Anyone opposed? Present and eligible. Okay, I'll stop the share. I will note one more thing while this is on the screen. We're going to come back with another amendment next month. Sorry.
Excuse me. Roberta did text me. She does support this.
Okay, good. Thank you, Roberta. So we're going to come back with an amendment next month for something that is new and is very odd. Specifically, is everyone familiar with 11th Avenue between 46th and 47th on the east side of 11th? It is an old candy factory that was converted to an office building for Ogilvy and Mather, the advertising agency.
Yep.
Very large, right?
Very large.
Right. So that was left out of our rezoning ask because, in fact, when we worked with it, that was a fully occupied commercial building with I think 2,000 people working in it. Ogilvy and Mather has since moved out of there, closed, and now we have a total remnant of manufacturing use on the east side of 11th Avenue when the blocks north and south have been rezoned for residential use. So we're going to be returning to the committee now to make that district consistent and put that building back in the residential zone, which was mapped back in 2009. But we'll again send it out in advance. You'll be able to look at it and see it. But we discovered that as part of this. Yes? Question, Paul?
No, I know the building. It's very large, very sturdy building. It would make a lovely place.
Could you convert it to residential?
Oh, it's a prime candidate. It's a very large loft building from the 1910s, like that. That is, and Betty has all the windows. It's got wings, the normal thing.
Oh,
So
that's great.
It's like an H-shaped building.
Yeah.
Great.
All right, so we'll move on to our next item. Oh, Yadira?
If they turn it into a residential building, will it be affordable?
There is with the new regulations coming down the block, there will be a affordable requirement for residential conversion as part of this. Actually, let me say what's being discussed in Albany today. That is a discussion. So if it comes through, we'll be in good shape with that. On this matter, I see Katie Savage raise a hand from the public.
I didn't even notice.
Aurora again. Aurora.
So Joe, I think we talked about this one time about like affordable versus affordable for middle income people. So would there be affordable for middle income?
We don't know yet what Albany is considering, but we know there's going to be an affordability requirement. And what I can tell you is what I've heard, right, in terms of the discussions, that it's something based upon MIH, mandatory inclusionary housing. And that does have some range, but not up to middle, it has it up to moderate income.
Okay.
Jessica?
I just wanted to add that Hell's Kitchen Land Use took this topic up at their meeting last week in terms of making recommendations for what conversions might include, and Chelsea Land Use is going to be taking up this topic on Monday. So any of you are, of course, invited to come to join that conversation about what affordability within that should look like.
And Hell's Kitchen Land Use did take the position that it should be a range of incomes for conversions, low, moderate, middle. Maria, any thoughts on this?
I got distracted for a second, but
not a problem.
but I did want Katie.
Yes, I'm going to say
Katie's doesn't have her hand up right now. Oh, now she does. Okay, so she'll,
if it's about this matter, bring Katie over, please. Nellie.
it is about the
okay. From the public, Katie Savage. She's coming over via Nellie.
Hello, long time no see. So my question in this area for rezoning is 627 11th Avenue, the former Lexus car dealership that is between 46th and 47th Street that is currently going through an approval process for a nightclub.
Right.
You know, we members of the community and local block associations asserted that this is primed to become a more heavily residential area. That's why we do not want a nightclub there. But the real estate agent for the owner kept saying that this isn't going to be rezoned anytime soon. It's going to take over a decade, blah, blah, blah. So I'm just wondering if we have any kind of timeline on this, and if anything in this zoning or possible rezoning would preclude a nightclub from being in that location.
If the nightclub permit is issued in the next year, that would be grandfathered in. Going forward, we don't expect this as a decade because, in fact, the mayor's office and the governor's office have really talked now about allowing conversion and residential use in manufacturing areas. That's being discussed in Albany today. We don't know as part of the budget what will happen and what it will look like, but we do know the public discussion has now moved very seriously into this area. And there was no political will 5 years ago. Now there is. So I would say it's a bit of the dice roll how Albany works, Katie. You know, we'll see what falls out.
Got it. But generally the community board's overall thought is that this stretch of the far west side should be residential.
The community board had actually requested it to be residential back in the 2009 rezoning. And then in 2015, adopted that position into the affordable housing plan. And it's been that position ever since. So that's not changed.
Okay, great. Thanks for the information.
Yep. Maria, any last thoughts?
Nope, that was informative. That was helpful information.
So let's go to our next item, which is an update on the temporary shelters. And I'm sorry to announce that DHS, after saying they would be here to report, will not be here to report tonight on the temporary shelters on West 39th Street and West 47th Street and 8th Avenue. Jesse informed me of this and saying that, as everybody knows, we have the Artel Hotel and the Econo Lodge that have opened up. The one thing that has changed is the Econo Lodge opened up for asylum seekers with families, and we were notified a week ago that it is now asylum seekers with adult children. That is the only change. Otherwise, we have no idea who the operator is. There's not even been a proposal on that. DHS is currently still operating those two shelters on their own. And I wish I can give you more information, but we don't simply don't have it. We'll invite them to come to our next month's meeting. Questions or thoughts about those?
Wait, Joe, the Econo Lodge is on 47th, right?
Yes, 47th and 8th.
No, isn't it Community Housing Innovations, or am I mixing up something?
You may have more reason. When I saw it last, it was nothing.
Well, I also tried to get information today from a DHS official
yes,
about Hogar, and I still don't know who is running it as of today. So
yes, I actually Maria and I were at a meeting we'll talk about in a second, where there was Marika, I don't know her last name, from DHS. We met many times in our meetings, and she definitely shared her frustration on being able to get us information. She really would like to. It's not there yet. Katie?
Thanks. Yeah, we just wanted to ask about Hogar, because I know a bunch of, not in our district, but in other places, a bunch of asylum seeking shelters have been opened recently, and they seem to all have National Guard sort of on the first floor, because they don't have providers yet. I mean, I think
Jesus,
there's a real shortage of providers. So I guess I was just wondering, so it sounds like, do we have any updates? I thought they'd said that Hogar was supposed to be starting in February, but we don't know.
We have Jesse has been back and forth at DHS. We know nothing, And they
Yeah.
keep apologizing. And that's why I spoke to Maria today. Marika
Right.
was like,
Yeah, I
very much
understand.
like, we're sorry, so.
They got lots going on, but yeah, okay, thanks.
Yeah. So then move on to this issue about NYCHA, Chelsea NYCHA. So the board was invited. Hector, you there, Hector?
Yes, I am.
Was that 3 weeks ago?
Yeah, it was approximately 3 weeks
About
ago.
3 weeks ago. So just give you just information, and then we're going to have the Chelsea NYCHA, both developer and the tenants association, come to a future meeting as they move it along further. Was invited to a meeting with the related companies, Essence, the partner with Related, the NYCHA tenant associations from Elliott, Chelsea, and Fulton, and all of our elected officials. And the elected officials were there in person, meaning and NYCHA too, Jerry Nadler, Brad Hoyleman, Eric Botcher, and Tony Simone. We were informed that they are discussing a major change in the project to move it from a renovation project, because the costs have gone up dramatically, to a demolition and new construction project throughout the entire 2 campuses. I would say this is a lot in flux. We saw information that was, I would say we saw a PowerPoint. That's what we really saw. There were lots of questions raised, and the tenants, the Chelsea NYCHA tenant associations, stated that they were in favor of this project. It was going to go back and be discussed among the NYCHA tenants, but it raises obviously all sorts of policy, and it raises questions across the board. And the reason I'm being very circumspect is because we're going to be having this at a meeting and talking about it in full, but we wanted to report. We were not going to report on it all, but then we realized once it was put out on a news site, then we have to speak about it somewhat. So, and I'm going to caveat again what Hector noted. No decisions have been made. Nothing is proceeding at this time. This is a proposal that is being put forth on how to redevelop and how to create the long-term affordability for the Chelsea NYCHA sites. And it also involves not just the demolition and reconstruction of the public housing, but freeing up 2.5 million square feet in one proposal for development of mixed income housing. So again, it's it's not, there's nothing buttoned up here. There's nothing laid out here, but that's the kind of the guts of it, Hector, right? Sort of like where it is at this moment.
Yeah, I do have to stress something though. One of the ideas we were discussing is that there will be construction before, if any kind of redevelopment is done on the old buildings or whatever, the new construction will go up first. So it's not like anybody will be displaced. Or
yeah.
Okay, so that was one of the main things we fought for, and we're moving forward with that. That's for certain. Nothing happens unless the residents are taken care of first, and we get to decide what the residents get to decide what the future entails with that.
So I will note again that I'll get you in a minute, Betty, that before we react to this, that nothing is decided, nothing is settled. The plan was advanced with the proposal for a revised plan was advanced with no displacement. But before we get into a long discussion, it does mean demolition of public housing, some being rebuilt under RAD, and then private development. So we know it's a huge issue to talk about. We're not going to be speaking about it tonight, but I want to put it out there as information. And Betty, you can now ask a very limited question on this.
Never mind. Now that you repeated what they're proposing, I just was like, am I really hearing this? Demolition of the building? I mean, it's like such a radically different thing. Hours and hours we've spent on making a plan for that. Anyway, that's it.
I would say again, that was not hours, Betty. That was like
days
weeks,
and
months, and years. Okay, we're going
more
to
like years.
right. Like we all got Hector had hair. And my hair was
exactly
dark, right? Roberta?
So I just wanted to understand what the role of the board is, given that there's a developer and then there are NYCHA tenants and then there's a tenant association. Where does the board fall in all of that?
So Chelsea NYCHA is in our neighborhood and in our district. We are a community board that comments on liquor licenses and bicycles and turning signals. We certainly will comment on the future of the NYCHA campuses in our district. we are so far from knowing where this is going, but we just wanted to be able to disclose this. The board's role in the past, well, Hector, myself, Betty, who else from the board, Hector, was on the task force?
What about Mike Noble?
Mike Noble.
Yeah, Mike Noble.
Mike
exactly.
Noble. There were a number of board members on the Chelsea NYCHA task force, plus many other stakeholders from citywide organizations, the NYCHA tenants that developed the whole, it was the Chelsea NYCHA working group that developed the whole plan.
But I think it's important to note that some of the people that were on that task force and on this community board are also tenants currently.
Yes, there were multiple Chelsea NYCHA tenants in the working group. And it is that group that developed the consensus, beat each other up, and came to a huge plan, which is on our website, and you can see it. And then that plan was the basis for an RFP, request for proposals, by NYCHA. And then the Chelsea NYCHA tenant associations, Elliott Chelsea and Fulton, met with the developers, went through a whole vetting process, and actually chose the Related Essence team as the developer for a plan that was to do renovation of all the buildings. And the crux of the issue that's being discussed is the cost of that plan was a roughly 376 million. And now that is 476 million. And now it has ballooned to 1.2 billion, and how to finance this and how to make it happen. Again, early stages, just want to get the information out that there's something that's being discussed, and we will certainly have everyone back to our community board in this committee to discuss it at length in full, from everything from tenants' desires, affordability, what this means in terms of development in Chelsea, and the policies and everything that flows out of this. We should note that there has not been a demolition of public housing in the city of New York. So that's why we went through the Chelsea working group process, because that was proposed initially to demolish some buildings. So now it's just a discussion. It's just a discussion, but it'll be a discussion that has a public element to it, because it's a publicly owned facility. Roberta, is that good to lay out for you? She can't hear now.
Yes.
Okay. Right.
Thanks.
Hector.
Yeah, again, I just want to, I know the word demolition is being thrown around quite a bit. That's the last thing we want to do. But if there's an option for people who've been ignored most of their lives and living in poverty, literally in a third world nation kind of situation, where there's rapid crime, rapid roaches, rodents, and it's frankly an eyesore in the neighborhood, and we know that.
But again, I want to say, Hector, you're not talking about the substance. We're not talking about.
No, I understand. I understand.
Lay it out there. That's all it is.
What I'm trying to say is, it's really up to the people here that lives here and how it affects the community. Okay, so
I'm going to note again, just for the public record, it is owned by the housing authority. The tenants, our community has leveraged the Elliott Chelsea and the Fulton Housing Tenant Associations into the project more than they ever have, into a redevelopment and a discussion about renovation more than they ever had in their entire history. And we're very proud to have worked on this all together. However, the redevelopment of two major campuses is a public discussion, and the tenants are a major lead in this. If they're not the only portion of that's going to have, this is a public discussion. It affects how this happens, how this works will affect NYCHA citywide. So that's all. Just want to put it out there. Whatever we do, we do.
And I just want to stress one more thing, and I'll let you go. I'm sorry, Joe. Yeah, you're right. There has not been any kind of demolition, but there have been NYCHA buildings that have been condemned, and even in public buildings as well, private buildings. And that happens quite often. And that's where these buildings are going right now. And that's why we're desperate to come up with an ideal plan to move forward for what's best for everyone here. Okay.
Just want to note that condemnation means that a city agency came in and said it's unfit to live in and it's structurally unsound. And that's not what's happened here. You have horrific conditions. That's where you are. Leslie.
It's a brief question, Joe. Who came up with this final or this most recent decision?
This is, I want to say, I don't want to go into any details here. This is a presentation that was made by the development team and the Chelsea NYCHA tenants, having worked. Hector, how long had you worked? Not on this version, but since the RFP, how long has that work been going on?
I can't really say. Basically, there's been talks going back and forth, but it's been.
No. When were they awarded the RFP?
Oh,
Like
my goodness. It's been about a year.
About a year.
Yeah, about a year and a half.
Like I would say a year to 14 months, something like that.
Right.
Right.
Oh, yeah.
And-
Yeah.
This is like, so in other words, yeah, remember, whatever you put out for an RFP is doesn't get done exactly. You have to go through a whole process, right? So they're going through a process, and this was the communication, very recent communication about this. That's all.
Hector and Joe, when do we envision us having like a larger public discussion about
We're
this?
working this through with Jesse and the whole development team and everything. We haven't, we're trying to understand. All we had was sort of the broad side, right? Now we have to figure out how do you proceed and how the discussion happens. I'm going to assume it's going to be in the next couple of months.
Oh, okay.
Katie.
Thanks. Eric Botcher's office hosted a really interesting talk, Zoom call in January, I think, where they had speakers talking about how the cost of repairing public housing in the city has, massively ballooned. So to your point about the fact that this is sort of a bigger public issue, not only do we have our very important buildings in our district, but clearly the city is facing this huge issue. And they were saying on the call that Eric's office hosted that they think that the cost to the city since before COVID has, I think, more than tripled or quadrupled or something. And they're trying to figure out how on earth they're going to fund all of that. So that this is part of a big issue. And I very much hope that obviously we're going to be advocating on behalf of the public housing in our district. And I guess we're just going to have to pay attention too to what's happening in the rest of the city to make sure that we're sort of getting our fair share.
So I'm going to close this off here, but I want to note again, the cost of construction, whether it be market rate or affordable, has of course gone up because in fact, the cost of construction materials and labor has gone up dramatically. Public housing is not singular here. It costs a lot more to build affordable housing and market rate housing. So it's a discussion that all these things like the supply chain, materials from China, all this kind of stuff, all factors in. I just wanted to lay this out. So it is out there. We have discussed it. We have talked about it, touched upon it, but we'll have full and deep discussions about it coming forward. And I'm expecting we're going to spend a lot of time on this during the rest of this year. So given that everyone knows about it, Hector, we can move on. Yes.
Yeah, I just wanted to make a correction. It's been 3 years since we selected the RFP the developer for the RFP. Okay, just wanted to make that.
Is it 3?
clear.
No, Hector, we were meeting in 2020 for on the plan. No, we were meeting in 2020.
Okay.
No, you think it was in the fall of 2020?
No, it was.
It couldn't have been.
Yeah.
We were in the working group. I remember we were doing Zoom land in the working group in 2020.
No.
And
We met for 3 years. We met for 3 years before the.
Yeah, we met a lot of years.
You're correct.
Right. Yeah.
Gotcha.
I'm not going to forget those meetings, Hector.
Oh no. But we
And
ended
they-
up all. We ended up hugging and
Yes, we
loving each
did.
other, right?
We sang Kumbaya at the
In the
end.
beginning, we wanted to strangle each other. I get it.
Hector, your meetings began in 2019, right? The working group?
No, the working group was convened in 2019, and then we hit COVID. We went dark for a while. We reconvened on Zoom, and then finished up on Zoom. And I think we finished up at the end of 2020, and adopted the report. Right?
Yeah, and all this time, the buildings have continued to deteriorate more and more, and less money are being put in. So yeah.
So everyone, thank you all for that. And I want to go to our next item, which is Maria and I want to talk a little bit about the process we went through at our last meeting. And Maria, set the stage for this so we can.
Where are we? Are we at? This is like old business?
We are at I put it on the agenda when we started.
Oh,
So
because
we're at
there
the
is
end.
something I want to mention
I'm sorry.
at the end for a new business,
So
I guess.
we're at the end of the agenda. So if you want to mention something new before we get to that, why don't you do that now?
Yeah, I just wanted to give a heads up. I'll mention it at full board. But so far I have been if you all recall back in now it's over a year and a half ago, about a year and a half ago, there was a mental health forum that Renee Kinsella from CB5 and I held that went really well. And we have been in talks about doing a second one. And then CB2, what is her name? Susanna Aaron approached us asking us about doing a mental health forum together. So the three of us are planning that. I'm not sure. So far, we're kind of talking about the end of April. We will see. However, we've had about 2 meetings about that, and it's about seriously and persistently mentally ill individuals who are street homeless is really what we wanted to focus on again, and talking more about, I'm thinking short-term solutions, but we will see. It's still being formulated. But I wanted to just give you all a heads up about that. And at full board, I'll have more details.
Thank you. And there's one more update. I'm sorry, I forgot. 201 7th Avenue. That's the building the committee considered 4 city-owned buildings on 7th Avenue and 22nd Street. That was the demolition of a city-owned set of buildings on the TIL program. We approved it for new middle-income housing. And during the course of the demolition, one of the members of the West 22nd Street Block Association and Save Chelsea, Pamela Wolf, discovered that there were cast iron columns in the ground floor of the facade at that building. And a whole effort was mobilized in order to salvage those cast iron columns. I was involved from the community board end and also from the Clinton housing end. And those columns were salvaged and they're in a storage yard on West 52nd Street between 10th and 11th Avenues to be reused, some in the building and some in a public location in Chelsea. Read about it in Chelsea now. It's the kind of thing that when you go on to community board, you never know what you're going to get involved in. And in this case, it was cast iron column salvage, one of which was 14 feet tall. So
Ooh, yeah,
quite a odd thing that the board's been involved in. Let's move to our last piece and now discuss. Maria, kick this discussion off.
So we wanted to get feedback from committee about the process of our discussion from last committee meeting where we went over the letter paragraph by paragraph, which right now I just know the letter was about, I think it was the Artel.
Yes.
The Artel Hotel on 39th Street. I had sent it out, a blind carbon copy to everyone and got some feedback. 3 people said it was a great letter. No one else commented. And then 2 committee members wanted to table it. And so what we decided to do was the chair made a decision that it was going to be tabled. And so we brought it back here to discuss it all together and ensure that it was a public discussion. And so just wanted to get feedback from you all, every single person on committee, please, about your thoughts about that process. Positive, negative, neutral, I guess, is really what I'm curious about.
So let's start with Betty.
I
You
see
must
Becky
unmute, Betty.
smiling, but I think I'm just going to start unmuting you, Betty.
Unmuting.
Okay.
I personally found it very tedious and time consuming. And I think that the concept was well intended for everybody to put their 2 cents in. So there was no backlash at full board or something like that. The concept, but I personally found it very, very time consuming and I felt very restless.
Okay. Thank you. Aurora.
Dora. Hi, I'm going to echo what Betty said. I found it really time consuming. I feel like we could spend our time on more productive things.
Leslie.
Yeah, I think if there were comments that should have been submitted in advance.
Paul.
Well, yeah, nothing new. Yes, I'm on the same page, I guess. Yes, time consuming. Well, hard to avoid it.
Katie.
Yeah, totally agree. It felt tedious and time consuming. So yeah, I agree that if comments can be, if the letters are I think the tricky part is having the letters drafted and submitted to the committee for review with enough time for the committee to provide comments, right? So I was absolutely one of the people who had comments on it and did start providing them, but frankly didn't have enough time, or, you know, the 36 hours didn't give me enough time to comment. So I thought it was just being tabled so that then we could all give written comment, not so that then we would all go through it line by line or paragraph by paragraph at the meeting.
JD?
I'm sorry, I don't feel this is any way for us to be able to operate as a community board under the restrictions of getting letters through, getting them approved by 50 editors on the full board. We just don't have. I have never in my decades on this board gone through something like this, where one or two members were unhappy with the letter and therefore we had to go through a line by line correction. I write a lot of letters over the years. Everybody volunteers their time. So to spend 2 hours going through a letter that most of the membership of this committee was okay with was frankly disrespectful to me. And I would just add one thing or two things. There is comment and then rewrite the letter and then send it out again and again until everybody is fully satisfied. If you're not happy with the letter, vote against it at the full board. And if you want some little changes that are grammatical or syntactic or whatever, email Joe or Maria and say, can you change this? I have a problem with it. See how that goes. They'll do it or they won't do it. I have enormous respect for Joe and Maria. They know what they're doing. They've had a lot of experience. And frankly, I don't mean to offend anybody, but that was disrespectful. And if this is the way it's going to be, I would rather not be on the committee.
I stopped by so that I can talk about this.
I'm sorry. Yes.
Oh,
yes.
Dolores.
I pulled over because
that's right.
I'm very happy JD said about the respect. What we did was actually disrespectful to the committee process. We have chairs of a committee. They're charged with, again, as volunteers to write the letter based on the commentary and the views. We actually have a great tool now that we record these, that we can go back and listen to what people said at committee, to go ahead and edit well in real time, which we didn't even have before. And the fact that we have some folks that want perfection or either have issues with perception in terms of language to the point where it's not even accurate about what we talked about in committee and what the community communicated to us in committee is utter disrespect for the process. So I hope that we do not go ahead and have this situation again, because all this does is literally cater to a minority of voices within the committee about how we are communicating the interpretation of our broader community's perspective on these issues.
Let's go to Hector.
I can't really elaborate on anything more than anybody else has said. I mean, yeah, I mean, a lot of the process when it comes to these things is very time consuming and yeah, it gets a little nitpicky, so to speak, where, you know, the devil's in the details, and I get that, but sometimes it's better to leave it for more knowledgeable people and have your input put in there, but maybe preemptively, like somebody had mentioned, you know, send your comments ahead before the meeting and stuff, so it doesn't waste so much time. But I do respect other people's opinions, obviously, but now when it's taking up so much time and the message gets lost in the length of time and the mess that it creates.
Jessica.
I unfortunately think I missed that part of the meeting because I was traveling last month. So I cannot speak to some of the things that have been referenced here. I am hopeful that we can allow for more time for letters to have the appropriate vetting and for, I think maybe I didn't participate, but if there is time for that, then vetting and edits can go back and forth in advance of the meeting. I don't often think that that's the place of a board meeting when people have the chance at committee or with the channels that are available to them. So I appreciate that it came back to committee and that there was that space, but ideally, I don't think that should be repeated. Rather, that time should be spent between the meeting and the board meeting to provide that feedback. But I think JD mentioned it, like consensus is often valuable, but it is okay for there to be dissenting opinions. And I think, you know, like over the long arc of our meetings and of our committee work, you know, we'll get to the right place or find that we are working hopefully more in alignment with each other and with a shared vision. But I think it's okay for there to be dissent and for people to vote against a letter. I think that should be very acceptable, and frankly happens at a lot of other committees, maybe just not historically often at this committee, and we have to learn to kind of be okay with that.
Thank you. I'm going to go to Roberta and then Pete.
I would just echo most of what Jessica said on process. I think it would be valuable ultimately to just have a little bit more time for review and input. I don't think it's particularly productive to have a line editing process in a public meeting, though I certainly understand if you wanted to review a fully revised draft in a brief period of time in a meeting. I do think that ultimately, despite the process, that the letter wound up in a better place. I think it received little controversy, and I think that was through the work of the committee and actually building consensus. And I think, Joe, you've spoken yourself about how important it is for the board to speak with one voice. And if that's what you want, then I do think it's worth kind of working through that process. But I certainly don't think it has to happen in a meeting over the course of 2 hours.
Pete, followed by Yadira, I guess, right? Yeah, Pete.
Yes, the back and forth changes made it very difficult to follow. And therefore, I got very little out of that process. And I'm just going to echo that we need to try to avoid that again.
Yadira, you're the last one, right? Yes. Yes.
You saved the best for last. I never ever want to do that again. That was
excruciating.
It was painful. And I do agree that this is a place where we should all be able to share our opinions, our comments, our thoughts, our ideas. However, I think there should be a certain level of respect for you, Joe, and Maria as the co-chairs, because you've been doing this long enough, not to age either one of you, but you know what you're doing. You know what you're talking about. And yeah, I will say, I apologize if the two of you felt disrespected by this, but I hope that we move forward in a better manner, because I definitely would never want to spend that time editing a letter like that for 2 hours.
So let me just give you a sort of preview of what we're trying to do with the board leadership. We're considering changing the day of our committee in the month, because one of the issues we have is that this committee frequently has to write very long, complicated letters, and they don't get written in a day or two. They take longer sometimes, depending upon what they are, right? So we're in the middle of discussing that with Jeffrey and Jesse to move the committee to the regular meeting day earlier in the month. Therefore, it can take, let's say, 3 or 4 days to write a letter, and then people will have a couple of days to look at it. But what I want to note, and then giving comments and go through the whole process. But I guess what I want to note here is the other strain, which is if we accomplish that, there will still be times that anyone can say, I don't agree with this. And that's normal. And we're not going to get language down to full consensus. But what I would appreciate always is if anyone votes in favor of something at the committee, you really must think twice about voting against it at the full board, because not everything's going to be as we need. We have to keep our minds. Roberta noted that I always say, the reason we have a good effect as a board is because we speak with one voice. And I will tell you from the development community, the public, the government community, they look specifically whether a board is speaking with one voice or is split. And that's how our elected officials and city officials read how to act on something. So you have to keep that in mind. And I can say, I'm saying that from my direct professional experience. If we have a vote that is, 20 to 22 or 23, we're not going to get pretty much as if we have a vote at full board that is, 45 to 1 or something. So just keep this in mind that our crucible is public opinion. It is batted around in committee where the work is done, and then things get fine-tuned or questioned by other board members at the full board. And I will note, we had many times where I have seen other members, not of this committee, vote against something that was like a 22-page letter. I mean, think about it for a moment. In our lives, in 22 pages, there's going to be something we disagree with. But the important point is to our public face out as we deal with city agencies, state agencies, and elected officials in order to make sure our community is protected, gets its fair share of things, and actually gets service. So that's part of our work that we do. So I'm hoping that the idea of moving the committee to an earlier day of the month, which is not settled yet, will begin to address this, and then we can still disagree, which is not a problem at all. That's the normal process of committees. I was advised by the chair, just have people vote no. I am going to say again, I will still continue to try to get consensus, go around the room here, ask questions, as I would do in public, right? So people can voice what their feelings are. I also want to know, sorry, go ahead. Yes, is that Yadira?
No, that was Maria, but I'll let you, I also want to know, go ahead, you were going to say.
Yeah, I also want to note that I believe our committee and other committees have suffered from the lack of meeting in person. That I don't care how much public participation we achieve by being on Zoom. The fact that we're not sitting in a room and the things that aren't happening are, we're not talking before the meetings, before it convenes. We're not having a side conversation, let's say, during the course of a meeting about something. We don't get to walk home with each other and then say, what did that mean? And how did that go? That's the thing that is missing from our function, where we actually are connecting with each other in a professional and community sense to understand what are the issues. And a lot of times we may be against X, but something in terms of why we're on the same page. Overall, our board is fairly aligned. And I'm going to say for the long-term members, I guess to Betty, right? Or Pete, in general, we're pretty much aligned as a board, right? That's, yeah, I mean, give or take, there's not a lot of horrible, disagreements, as opposed to other community boards where there are factions and disagreements and they don't get paid attention to because they're so split. Maria, take it away. I've spieled enough.
Can I spiel a little bit?
Of course.
I joined the board in about I think it was 2014. I was still in graduate school. Yes, getting my second master's. And so I recall being at one of my first meetings. Wait, do I really want to share this story? Not really. So let me not share that story right now. But the three things I was going to say, Joe, actually, when I was going to cut you off, one of the things that I was thinking is that I am not a fan really of having to run around the district to attend meetings, but I think meetings in person helps build connection and rapport. And I do think that we need to get back to that. Even if it's every other month, which is something I would think is great, but being able to be around one another, again, I think would be helpful. And also to have discussions like Joe is saying before the meetings and even after. That used to happen all the time before. That's how people got to know my son. The other thing I'm thinking about is I agree with what everyone has said so far. I'm not feeling as like JD and Dolores feeling like I was disrespected, but I wasn't happy about what had happened. It was tedious, it was time consuming, it was frustrating for me. However, I do agree with what Roberta said in the end. I think the letter was better despite that. I really do think the letter was better after. And also, Katie mentioned something and Jessica mentioned something that I agreed with also. I don't remember who said what, but also the fact that, and Joe mentioned it, us having the meetings earlier in the month would give us more time so that we can do that process, so we don't have to do that again. I think that's an excellent idea. And I think that was it. Oh, that's what I was going to say, something about voting against a letter. I think it is really important. I mean, Joe's been on this board since, I don't know, for forever, but even when you think about history, I mean, people are more powerful and groups are more powerful when they're on the same page and unified instead of being divided on certain things. And I just think it's really important that, listen, you put in your input, you all have valuable opinions that I appreciate, even if I don't always agree, right? And it's okay to not, we don't always have to agree, but like, we are here for a purpose and a reason. And it's not only to represent, like, I don't always do what I think is best in terms of, how do I say this more appropriately? I don't always say to everyone, it's not about me. That's what I want to say. This is not about me. I sit in this seat and I represent the community. That is how I feel strongly. And I represent what I continue to hear from people in these public meetings. And even when I talk to, I know a lot of people in the community, and I work with people in the community and get to hear their pain and their stories and their lives and what they're experiencing in this community, right? And I feel like that educates me here, and I can serve others here. I am not serving my purpose. For example, what is it, the MTA site? That was the MTA site right there on 9th and 54th. I would have been happy if it was all supportive housing, but I heard what the community said. And that is the role that I have to take. That is how I feel about sitting in this seat. And that's really important to me. And I sometimes get the impression that committee members sometimes are voting for and advocating just for what their personal view is. I'm saying that in a general way, not specifically here. I think I'm done being on my pedestal, because the reality is I'm being a little hard right now, but we all have our personal experiences and we come to the table with that. So it's also my personal experiences of living in this community and my family utilizing almost every social service that is in this community. I could run down certain programs that are in this community currently that my family has utilized. And I value deeply people that we consider quote unquote vulnerable. But sometimes those people we consider vulnerable are stronger than we really recognize and know. Okay? I think I'm done now.
Thank you, Maria. We'll end with Aurora.
So I am not going to age myself because I have decided to not age past 25.
I thought you were 26.
Exactly, Joe, exactly. But and I have been here my whole life. But one of the things I hear, I think everybody on the committee saying, is it's okay to disagree. We don't always have to agree together. And I just wanted to kind of refocus that, is that because sometimes it can get lost in some of these bigger words that we're saying to each other, but it's okay to disagree. We're not always going to have the same opinions, and that's okay. And how do we kind of reconcile from that and come full circle? And just realizing that we're all on the same team, right? And remember that I'm not a day over 26, Joe. Not a day.
I really want to talk about this in this way, because I think it's the kind of, we never have an opportunity to talk like this. We would be sitting in a room where we'd have this conversation after a meeting, a few of us would stay and talk. That's the normal process that happens that we haven't had the ability to do. So at least this begins it. And, one day we'll be out of our little boxes. Yes, we have definitely increased public participation, but I think it's sometimes at the expense of knowing how to work through issues and with each other, and yelling and smiling and then laughing afterward. And like, after many committee meetings, let's have a cup of coffee if I'm really pissed off at you, kind of thing. Or, this is what we haven't done. So I'm looking forward, as we move out of our COVID world, toward helping put Humpty Dumpty back together again in terms of the board function. And we're all human beings here and doing the best we friggin' can. So, is there a motion to adjourn from our existential discussion?
Move to adjourn.
Second.
Please raise your hand if you'd like to adjourn.
All in favor. Okay, great.
Thank you all. See you next
Thanks,
month.
y'all.